Usually the ear, nose and throat problems many people are neglecting, and the early stages, whatever ear problem or nose problem or throat problem, if you diagnose the smallest problem, you can treat medically. If the smallest problem we are unable to treat medically, if you neglect, that may go into the complications. That complications may lead into the so many, sometimes the fatal complications also will happen. And see, just for example, a diabetic patient getting small pimple, commonly they call pimple, it is not pimple, in medical terminology it is called furuncle. This is called dangerous area of the face. Why it is called dangerous area of the face is the blood circulation from here goes into the directly brain. If the infection happens here, what will happen? Suppose any pimple comes, they think pimple comes on the face, but any furuncle that comes, furuncle is the infection of the skin. Any furuncle comes, what they think, we can pluck it out. So like that, if they do keep the finger here and pluck it out the furuncle, what will happen? The infection directly spreads through the blood channels to the brain. The patient may die. Yesterday one patient came, day before yesterday, I started on the best antibiotics available in the world, the piperacillin tazobactam. I prescribed 10 injections, they purchased only 2 injections. 2 injections were given. I sent the patient out, I called the patient's son inside. I told the patient's son, this is called dangerous area of the face. Any minute he may go into the complications. Already he had injections, 10 injections or 20 injections outside the city. Other than Hyderabad, he got the treatment, not subsided. He came with the swelling of the nose and the upper lip. So I told, this is dangerous area of the face. He need a very good medical treatment under my supervision. What happened? 2 injections given. He developed more swelling, and he thought the injections is leading to the swelling. No, he never thought about the disease. And yesterday I got a phone call. Sir, my father face swollen. I told, man, already I called you inside. Personally I told, it is a dangerous problem, the dangerous area of the face. Don't neglect. Please immediately admit the patient and we got the medical treatment, and the patient will survive. And here one example I want to tell. When I am doing my post-graduation, one ambulance driver, he came with a small furuncle here, is alcoholic, is a diabetic. Those days I am telling about 23 years back, the ciprofloxacin and other generation cephalosporins are not available in India. Even ciprofloxacins, to buy the ciprofloxacin is very costly. Ambulance driver of the government hospital, can he buy this type of antibiotics? He can't buy. But my superintendent, he brought all the medicines from the abroad. By the time the medicines reached the Guntur, Andhra Pradesh, the patient passed away. He died. So what I mean to say is, even a simple problem, consult the doctor. Please forget about the work you have to do. You do the work and take a little break, and go and consult the doctor. And with a simple medical treatment, with the simple advices, simple precautions, what to do? A pimple happens in the nose. Please don't pluck it. And don't pluck it, don't rub it, and don't scratch it. These are the precautions. If you take these precautions, simple antibiotic, the persons can survive.